This video was prepared as part of the course requirements of Human Anatomy at Saddleback College. The human hand is composed of 27 bones. Of the 27, 14 of these are phalanges. The human foot has 26 bones, 14 of which are also phalanges. Together, the bones of the hands and feet make up a quarter of the 206 bones of the human skeleton. Phalanges, which is plural for phalanx, originated from the Greek term referring to an ancient Greek military formation in which soldiers stand side by side in rows, consistent like phalanges of the hands and feet. Phalanges are the bones that make up the fingers and the toes. There are 3 phalanges per digit. These are described by their location. Proximal, meaning closest to the body center. Intermediate, referring to the middle of the 3. And distal, which is the farthest from the body center. The exception of having 3 phalanges per digit is the pollex, or the thumb, which only has a proximal and distal phalanx. The hallux, or first digit of the foot, is similar to the pollex in that it does not have an intermediate phalanx. Each phalanx has a hinge joint, called the interphalangeal articulations. The proximal interphalangeal articulations lay between the proximal and intermediate phalanges. The distal interphalangeal articulations lay between the intermediate and distal phalange. These hinge joints are where the flexion and extension of phalanges occur. Phalangeal injuries are quite common, especially in sports. The hand and foot are the prime regions of impact in many full contact sports, such as rugby, football, and ice hockey. The most common type of phalangeal injuries are closed fractures, when bones are broken but do not pierce the skin, and fracture dislocations, in which the phalanx is moved out of place due to the force of impact. Extra-articular fractures of the distal phalanx are common and associated with significant soft tissue injuries. These fractures do not extend into the joint. Hand fractures are treated in stages of alignment, immobilization, motion therapy after 3 weeks of immobilization to reduce the stiffness, and surgery in more extreme cases. The function of the hand phalanges is to provide dexterity, such as transferring an object from one hand to the other, known as motor skills. The function of the foot phalanges is to provide stability for the foot and disperse the body's weight evenly.